Case 9 is an older gentleman with a mass along the posterior aspect of his knee. An ultrasound was ordered to look for a Baker's cyst. Just to review the anatomy, the skin is the most superficial part, with the probe being right here. The subcutaneous adipose tissue right here. This echogenic line is the investing fascia, and then deep to the fascia is the muscle. If you look just deep to this fascial line, you see this tubular structure in short axis. There's an echogenic wall with a hypoechoic lumen. And as we scroll proximally, you see the vein, which is what the structure is, beginning to dilate, and then it runs directly into this mass that's appearing. So you see it's within the mass, and then it just disappears in the mass. The mass is irregular, hypoechoic, and there are some areas with marked decreased echogenicity as we scroll through them. We see the mass is pushing on the fascia, displacing it, and also pushing on the underlying muscle. Long axis view showing this hypoechoic lobular irregular mass pushing on the adjacent muscle. Color Doppler demonstrating flow along the periphery and centrally within this mass. So we have this hypoechoic irregular mass deep to the fascia with internal flow. This is not consistent with a lipoma nor a Baker's cyst, and these ultrasound findings are concerning for a soft tissue sarcoma until proven otherwise. Moreover, continuity with the vein is suggestive of a Leiomyosarcoma. An MRI was requested. This is an axial proton density fat suppressed pulse sequence, and we see this thin little line here is the investing fascia with the muscles deep. We see the subcutaneous tissues here. And within the plane between the muscle and the fascia, we see this vein right here. If we follow this vein back up, it dilates right as it gets close to the bottom of this mass, and then it runs right into the mass, just like we saw in ultrasound. We see this somewhat heterogeneous proton density, hyperintense mass. It causes compression on the adjacent muscle. It displaces the overlying fascia. On this T1 fat-suppressed post-contrast series, we again see this vein deep to the fascia, and as we come proximal, the vein dilates and starts to fill with this enhancing material, and then it runs again directly into this mass. We see this solid mass with areas of avid enhancement and some areas that enhance a little bit less. So this was, again, interpreted as concerning for a sarcoma. It was resected, and at surgery it was shown to be in continuity with a vein. The vein was also resected with it, and final pathology confirmed leiomyosarcoma.